In this lecture, we will take a really close look into acne mechanism of formation, so join us in the journey of an ambitious pimple. In the previous lecture, we explained a picture like this about the skin structure. Do you remember all the parts we mentioned? Pause the video and try to identify each part and its function. As we said before, this is the hair follicle, muscle, blood vessels found over here, sweat gland, and the most important, the sebaceous glands over here. In this picture, we see the oily glands in more details, and within these glands is the oily sebum. Sebum in oily glands and within the ducts is clear and sterile and contains no free fatty acids, but the environment of the hair follicles is good for and favors the growth of the bacteria like P. acne or Propionibacterium acnes, Staph epidermidis, and even fungi or yeast. Don't bother yourself with these pictures of bacteria taken under microscope. Just think of the bacteria as these bad boys over here. One of the first steps in the career of acne is the formation of the microcomido. That's a small head or pimple or zit. In patients with acne, the resident bacteria, especially P. acne, are increased in number in oily follicles. They produce substances that destroy the surrounding area, right here, and other substances that divide the fats into smaller substances that affect the cell growth at the top of the base of the hair follicles over here, leading to an increase in number of cells there abnormally, like we see in this picture. As we can see, the cells here are increased in number. These cells are blocked at the entrance of the hair follicle and substances accumulate. Moreover, these new cells stick to each other even more and more, forming what is called a bottleneck phenomenon and subsequent microcomido formation. This is how what is called a closed comido or a whitehead is formed. So the word comido is the exact translation of small head. So again, abnormal cell growth leads to bottleneck phenomena, leads to accumulation of materials that leads to the formation of whiteheads, as we can see here. Because of the very narrow opening to the skin surface, there is an accumulation of loosely packed shed cells and sebum. With expansion of the comido, the contents become closely packed, and as the forces increase, the comido wall ruptures with expulsion of these irritative cell products and sebum to the surrounding. So, all the loosely packed contents spill out into the surrounds, and these materials are very irritative and cause inflammation. At this point, this is what is called an open comido or a blackhead. Blackheads appear black because of melanin deposition, which is a dark pigment, and it's also due to lipid oxidation within the debris that is responsible for the black coloration. Free fatty products that were spilled out are the best invitation cards for white blood cells to join the party. These cells try to help in controlling the bacteria and the irritative fatty materials, but end up making more damage at the site and increasing the irritation and the inflammation, just like a friendly fire. The type and degree of inflammatory response of the white blood cells determine the lesions seen. If white blood cells predominate, inflammatory acne is produced with features like a suppurative pus bags called pustules are formed. Also, inflamed papules, nodules, and cysts. The type of inflammatory response also plays a role in the development of complications seen later on. You must have said now, whoa, hold your horses. These are too much medical terms to hear. Well, in dermatology, we like giving fancy medical terms to skin lesion descriptions according to the size, shape, content. For example, a small pus-filled lesion is called a pustule, like here. Elevated encircled fluid-filled lesions are called cysts, like here. Papules and nodules are hard and elevated, like we see here. You don't need to memorize all these things. Understanding the complete picture, it's a continuous scenario of subsequent stages, from obstruction to accumulations to spillage to irritation and inflammation by white blood cells in the battlefield. By this, we move from white and black heads to inflammatory acne of papules and pustules, finally to cysts and scars. And according to the grade of acne and to the area of skin involved, the dermatologist chooses the treatment option, as we will understand later on this course. Things can go even worse if complications develop, like skin darkening or hyperpigmentation, scarring, and skin overgrowth or keloid formation. That happens in susceptible people. What we said earlier applies also to acne found in sites with well-developed oily glands, most often the upper chest and back. They said about acne, a geek isn't a skinny kid with a pocket and acne. Being a geek just means that you are passionate about something. Olivia Munn.